Welcome back, viewers. Tonight I'm going to be talking about EEG and test prep. As some of you have known from my first two videos, that I have an EEG scheduled tomorrow for 8 a.m. tomorrow morning. And as I've mentioned in my previous videos, there are different lengths of EEGs and each one has a various different test prep. That being said, this EEG that I'm having is only going to be for an hour, where I've had EEGs that are 72 hours to they last 5 days. And with each of the various EEGs, their lengths, there is different prep work for that a individual with epilepsy has to go through in order to prepare for these EEGs. The hour EEGs personally are a least favorite of mine because they take more stress out on my body and more stress out in the individual, in my opinion. And here's why. When I'm going to do a short little description of my experiences between a 1 hour EEG preparation versus a 72-hour EEG preparation. For this EEG that I've had to prepare for, I have been sleep deprived for about 36 hours now. Doctors require you to be sleep deprived anywhere from 24 to 48 hours. It all depends on what your level is and what your threshold is. I had to stop eating. My cutoff time for solids was at 5 p.m. yesterday. You have to go with no caffeine for 24 hours before your EEG, no nicotine, no alcohol. So for those of you who are smokers, or for those of you who like to have an occasional cocktail here and then, you wouldn't be able to. And including going off of that, I've had to, as you can tell, my hair is wet. I have to shower. You cannot put any product or detangling, and I have long hair, so combing out my hair tonight was a little bit of a chore without any help from a detangling spray. That being said, to keep the conversation going, with this EEG, I don't prefer them because it takes more stress out on my body. There's more work that has to go into it versus what it does when I have to have a 72-hour EEG. I don't have to be sleep deprived for a 72-hour EEG because I'm going to be hooked up, monitored, videoed for 72 hours straight. The only thing I don't like about the 72-hour EEGs is that they have me use a commode. And I feel I'm able-bodied enough to use the bathroom, but since I'm a fall risk, I get to swallow my pride and my dignity and get to use the old lady bathroom. No offense to viewers, but I don't know what else to call it at this hour. But fast to get back on track. With the 72-hour EEG, I also have my head wrapped up and it looks like it's bandaged, essentially. This one, there will be none of that. It's simple, no oils, nothing in your hair, so that way the electrodes stick to your head for the hour that they're going to do testing. And that being said, tomorrow they will be hooking up about between 25 and 50 electrodes to my head, so I will be looking like some awesome science experiment, and yes, that is sarcasm. For a person of color who has to have a EEG, when your hair is if you prefer the term ethnic hair, textured hair, whatever your term is, my best friend in the whole wide world, we had sat down and had a conversation about this. For her type of hair, she has very kinky and very much African American hair. She has that type of texture in her hair to where she has to constantly put grease in her hair, conditioner, and to take care of it, to keep it hydrated, because her hair doesn't naturally produce the oils that mine does. So for her hair, this would be a much more horrific, as she calls it, not horrendous, horrific adventure. And her jokingly sarcasm goes, better you to do it out of the two of us, because I wouldn't be following the rules. That's my best friend for you. But to tell the difference of just to give you an idea of what someone has to go through, that's the process for a 1 hour EEG scheduling. Is there's that much more prep work that goes into it versus a 72-hour EEG. The reason being is for that short time you're hooked up to the machine, they want to do whatever they can possible to stress your body out so they can trigger a seizure to figure out if they have progressed, if they're stagnant, or if they've stayed the same, or they just want to figure out what's going on, so they intentionally stress out your body. The other con to having a 1-hour EEG to a 72-hour EEG is tagging along with all the prep work is it takes me 3 days, depending on how long they have me sleep deprived for, to get back to normal, to get back to a regular rhythmic pattern. So some of my friends have commented of how they envy the quality that I can go so many hours without sleeping and still function like a regular human being like that has 8 hours of sleep. I know you guys don't mean any harm by that, and I appreciate that, you're seeing positive qualities in me, but I have had so many EEGs. Like I said, I've had epilepsy since I was 18 months. There's a reason why I can go 24 to 48 hours without sleeping when I was in college and pull all-nighters or function on 3 to 5 hours of sleep. I appreciate the finding the positive qualities, but if you were to have known what I have gone through to get to that point, to be able to have that skill, it's really not something that's admirable or that really paints a pretty picture. And so to continue forth with the whole stressing out your body and pros and cons, like I said, it takes my body longer to recover from an hour EEG than what it does a 72-hour EEG, because I don't have to be sleep deprived for the 72-hour EEG. I don't have to limit my liquids or my food intake. For a 72-hour, I come in, they hook me up, bandage me up, get me all sorts of wires coming out of every literal hole that I have, like clothing wise, and I'm confined to a bed. And those of you that know me, I'm a busybody. I do not like being confined to a bed. So that's pretty much, besides the commode, are the two cons that I find with having a 72-hour EEG versus having a 1-hour EEG. Now, to touch on what this does, I have my mom with me here on this trip for support. For those of you that are parents to children with epilepsy, understand that this process also takes a toll on our parents, on our caregivers, our spouses, our loved ones. Because before I was able to master this so-called talent of staying up for hours on end, my mom would have to stay up with me, and she's my level of support. She's also how I get back and forth to the hospital. So it also took a toll on her. And just as much as you think as I'm exhausted, it exhausts my mom even more. But it also exhausts our spouses, our loved ones, our caretakers, just as much as it stresses us out. Because reality sets in for them that their child does have health problems. Their child's life is going to be different, or their spouse's life is different. That reality and the fears that I talked about in the first video all set in. They become a reality. It's no longer just a dream that you can pretend like it didn't happen, or just brush it off and pretend like you can go back to everyday life. That's not the case. It takes a toll on our loved ones to see us hooked up to a machine, to see that that's our norm. That's our life. When if they could, they would switch places just so they don't have to see us go through it. So I'm doing this segment to give you an idea of what goes into prepping for such medical testing from the view of the patient. High five to some of my friends who are in medical school and going for their PA. I give you huge shout outs, and my advice is get to know your patient. They have a story to tell. They want to talk to you. Some of us are afraid. You don't really want to get to know us, that we're just someone that's on your roster to come and see and to check our stats. We'd actually love to have a conversation with you and ask us how our day is. I know I do, but I can't speak for everybody else, but only myself. So that being said, I will be going live tomorrow because, again, with my philosophy that I described in the first video, right now I appear normal. I look like anybody you would see on the streets. Tomorrow, I hope that you guys watch the video and the end of this part of the segment of Life with Epilepsy. I will be continuing these videos and to take requests on what people would want to know about epilepsy, what if they have questions, or explaining epilepsy even further and watering it down. Again, I'm not a medical doctor, but I've lived with epilepsy for 27 and a half years of my life. I have a pretty good grasp on how it affects the individual living with epilepsy. And I've done enough work and research with the Epilepsy Foundation to pretty much speak for not a medical doctor, but give you an idea of what it's like and help you get informed. So, that being said, I hope you tune in to tomorrow's segment to see what it's actually like and why I have the fears that I do and the realities for an intimate look of what epilepsy is like behind closed doors. I also wanted to give shout outs to those who have tuned in, to have watched, to those who have given the encouragement and the positive feedback. You do not know how much I appreciate it. You are my fuel, you are my strength, you guys are my support network, and I hope that you help me spread this message, help spread this awareness, and hope that you're all going to tune in and watch what happens tomorrow, and I'd be happy to answer any questions. Drop them in the comments below or feel free to message me. Either way, it'll be fine. And thank you for some of you. I can see that your prayers are being sent. My mother and I appreciate them. So far today, my mood as of right now, I'm very, well, I'm exhausted. I've had 3 seizures as of today, as of midnight tonight. But again, that is normal. This is to increase and to trigger, do all they can to trigger a seizure. So on that note, I hope you all have a blessed morning, and we will see you in the morning, and thank you again for your support. You all have a good night.